My client is a retired fireman who's had several injuries and had a tear of his gluteus medius tendon that was surgically repaired. And you had some calcification there that was also repaired.
Yes.
And you have pain in the posterior pelvic region called sacroiliac area pain. One finding is that this shelf, which I call the anterior iliac shelf, is lower on this side. And that's a much less subtle thing to palpate than the ASISs. The ASISs are somewhat indistinct in some people, but this shelf is very distinct. Now I can induce motion of the pelvis, and the pelvis should move with the trunk, and the pelvis should move on the hip joints, on the femoral heads. On the right side, I'm not able to take up the slack. I'm pushing with a lot more force, and there's no movement. Okay? Now this doesn't mean that the ilium rotated on the sacrum. It doesn't mean that your sacroiliac joint is stuck, although there's a lack of motion translation through the pelvis. Okay? It could be the whole pelvis being twisted with the trunk and with the hip joints. Okay? And that may add to nociception. Let's have you lie on your stomach. And with that pattern, I'm palpating the flat part of the ilium right on the middle on both sides, and I call that the posterior iliac shelf. And with this pattern, just want to check my camera angle. It's probably too subtle for the camera to capture that, but it's higher on the right side, whereas palpating PSISs can be really subtle. And I'm going to do an inferior spring test, and I can get movement to translate through the left side. When I come to the right side, there's a lack of inferior motion translation. Okay? I can do a superior spring under the sit bones, and I see your head bob. Motion translates through all these structures. And on this side, motion translates through all these structures. Okay? The self-treatment for this twisting pattern of the pelvis is really simple and quite effective. Let's have you lie on your back. And you can bend your left knee for comfort. And what you do is you hug the right knee to the outside of your shoulder. So it's outward to about a 20 to 30 degree angle. And I want you to maintain that stretch for 2 minutes. And I want you to do this once a day. Okay? And it primarily stretches the adductors and the medial hamstring of the right hip.
I can feel that.
And those muscles can certainly influence position and mobility of the entire pelvis. But it also stretches the gluteus maximus and some of the posterior spinal muscles as well. So I'll stop filming here, and then we'll come back and film the response to your self-treatment.